Dr. Brown, can you describe your involvement with the start of the Scribe Optimization Program?
Sure. I've had my scribe for a little more than a year, and we have a pretty good flow, but there were definitely things that we could do better. And so we had somebody from Scribe America come, who's an expert, and watched both me and my scribe working together, saw what we were each doing with the patients and without the patients, and really nailed down and looked and gave us advice on how we could improve our working together and improve our functionality so we could get more out of the program. And it was really, really useful for me. For instance, one of the biggest ways scribes can help us is by writing out patient instructions. And I was unfortunately spending way too much time myself in the instructions, and that would keep my scribe from being able to go in there and write things out. And so that really, she said, stay out of this patient instructions. Don't go in there unless you have special permission, because that's where my scribe's going to be putting the instructions in. It's been really helpful. It's one of the best things. The patients are thrilled with the good instructions they get at the end. And so that was a really, really helpful way. That was a good example of how the Scribe Optimization Program can help.
Okay. Can you let us know how long you've had your scribe?
I've had my scribe, I think she started in January or February of 2018. So
Okay.
more than a year.
Okay,
Yeah.
cool.
She's about to leave me though.
Oh, she is. Are you going to get a new scribe?
I hope I'm going to get a new scribe. Yes, I'll get a new
New
scribe.
scribe.
But I don't know who it is yet. And
So-
hopefully
Yeah.
Prisha will leave good instructions.
So it sounds like your experience with the scribe has been very positive.
It has been.
Are there any things that can be done to improve the experience for a provider like yourself or any other providers that have
Well,
the scribe?
I think I've known of other providers that didn't have as good scribe optimization help.
Mm-hmm.
It really depends on the person giving the advice and watching, and if they can really look and see what needs to improve, they can really help providers do a better job. But it really takes a special person to be able to help people optimize. So that's the first thing, is finding somebody that's really good at that. The second thing is the way I use my scribe and get my money's worth from her is she really helps me, in particular with my HCC coding of the Medicare patients. And I can put the diagnosis codes in there before we go in the room, and then she's able to capitalize and document our talking about those and really improve that. So my HCC coding is really good. She's also really good with Medicare Advantage patients, where I can do both their physical and their annual wellness visit at the same time. So we get 2 notes, 2 visits for one. It's a really great, that's been really helpful.
Awesome. Do you know if other providers are also experiencing the same?
I think
Experience.
everybody's experience is different. I think some scribes are good. I think some have had better direction. I think it's hard sometimes for providers to feel safe giving feedback, and that's why I think the scribe optimization thing can be good, because it's a safe way to give feedback without feeling like they're hurting somebody's feelings.
Okay. Cool.
That's why I think it's good, because most providers aren't as good as we'd like in giving feedback.
Yeah. So prior to having a scribe,
Feeling comfortable giving feedback. I want it, not that they're not good, but they don't feel comfortable doing it. Yeah.
Okay. So prior to having a scribe, how long do you think you would say you've spent on charting without a scribe?
Oh, I definitely go home faster.
Now.
I would say there's some days when I still don't have a scribe, like on
Yeah.
Saturdays and some Wednesdays afternoons, and it takes me longer. It takes me at least, I'm spending at least 30 minutes to an hour less a day.
Now with the scribe?
Yeah,
Yeah.
with a scribe, yeah.
Do you have any other comments about the scribe program?
I think it's good. I think everybody is individual in how they will use a scribe. I think there's ways to maximize the use, and for me it's been, I kind of pre-populate the diagnosis codes before I go in the room, especially with complicated patients, and that helps give the scribe direction, and I would encourage people to do that.
Okay, perfect. Thank you.
You're welcome.